So these slides are visible now. Anyone can tell?
Yes, sir.
Hello. Okay, visible.
Yes, sir, visible.
Oh, okay, thank you. So first, what are the importance of Gpat coaching? Means what are the not the Gpat coaching? So what are the basic importance of Gpat means? Gpat qualifiers are eligible to take admission into the AICT approved institute. Like 841 total 841 pharmacy institutes are there across the India. So we are eligible for this 841 pharmacy institutes. Okay. Next one is, and Gpat qualifiers can get admission at best reputable institutes like ICT Mumbai. So these are the best institutes compared to others like ICT Mumbai, IIT BHU. So these are just rank. For ICT Mumbai, we need 1 to 20, top 1 to 20 rank. For IIT BHU, we need 1 to 100 for general category and 1 to 1000 for AC and ST category. Next one is Punjab University and Dipsar, Jadhpur universities. So if you get qualified in Gpat, just you can apply based on Gpat, you can apply to these institutes. And you can get good package compared to other institutes or universities. Okay, these are best reputed universities in pharmacy. Next one is we can get stay fund. We can get stay fund 12,400 per month. Okay, and next one is GPAT qualifiers. We can write NIPER JE exam. NIPER JE. All of you know na NIPER JE. 7 NIPER institutes are there. All of you know NIPER is the National Institute of Pharmaceutical Education and Research. The slides are visible at least.
Yes,
Yes, sir. Yes.
Okay. So these are the importance. Next one is we can eligible for both the SRF, mean junior research fellow and senior research fellow. Means for research, if any one of you are interested, you can eligible for this junior and senior research fellowship, and you can take PhD admission based on GPAT. And next one is GPAT qualifiers are also eligible for PhD. You can do PhD at CSIR laboratories. If like after MPharm, you can do directly PhD. That is integrated PhD is there. Just if you need any information on this, you can go in YouTube and you can search. And next one is coming to the GPAT point of view. So we need to know the basic information. Means first one is weightage of subjects. Okay. In that first one is we need to focus the pharmaceutical chemistry. 38 questions will come. Each question carry 4 marks, then total 152 marks. Next, pharmaceutics, 38, pharmacology. So majorly we need to focus on these three: pharmaceutical chemistry, pharmaceutics, and pharmacology point of view. Okay. See, before we need to start departments, we need at least the basic information. So we need some basic information in that. First, we need to read majorly about the chemistry, pharmaceutical chemistry, in that organic chemistry and pharmaceutical analysis. Next one is pharmaceutics. In pharmaceutics, we need to focus about all the like tablets, parentals. I will tell what are the topics we need to focus in pharma. Next one is pharmacology, like pharmacognosy, 10 bits. The weightage is 10 bits, total 40 marks, and other minor subjects we need to focus. Okay, first I will tell, so what are the topics we need to focus? What are the topics we need to focus in pharmaceutics? First one is pre-formulation. See, definitely one question will come from this pre-formulation topic. We need to follow Remington. Next one is surface and interfacial tension. Next one is surfactants and polymers. See, the surfactants are like cationic, anionic, and amphoteric surfactants are there. And the polymers are also like different kinds of polymers are there. We need some basic information about the surfactants. Like for example, if you know the cationic surfactant, This cationic surfactant we can use it as a preservative and conditioning agent. Means in case of air conditioners, air conditioner is different, normal shampoo is different. Okay, so like that we need to know some basic information. Cationic surfactant we can use as a preservative and conditioning agent. Next, colligative properties, isotonicity. Next, dispersion, colloidal dispersion. Okay. Next, coarse dispersion. Under coarse dispersion, we need to know about suspension and emulsion. Next, rheology. We need to focus the rheology topic and micromeritics, tablets, capsule. This comes under solid dosage form. Next, parenteral dosage form, complexation, aerosols, and pharmaceutical jurisprudence. See, we need to know about this basic information. How many topics are there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Like total 14 topics are there. In pharmaceutics, we need to focus about these 14 topics. Majorly, first, before reading all other topics, we need to focus majorly on this topic. So no need to read the entire syllabus, whatever it's there in whatever given in the syllabus sheet. So just we need these topics majorly compared to other topics. Okay. Next one is, and they will ask rarely about the semi-solid and suppositories, cosmetics, microencapsulation, novel drug delivery system. Means least 1 or 2 bits they will cover from this area. Next one is pharmaceutical chemistry. In pharmaceutical chemistry, we need to focus majorly about organic chemistry. We need to focus about organic chemistry and pharmaceutical analysis. When we come to the medicinal chemistry, we need to know about first the drug structure. If we need to answer the medicinal chemistry MCQs, means we need to know about the first the drug structure and the generic name. Generic name. I will tell if you all of you are attending the classes properly, means definitely I will give this. How can we write the IUPAC name of a drug? Okay, the basic nucleus. See all these basic nucleus of a drug and classification. Next one is metabolism, synthesis, SCR. All these are completely depend on the generic name. If you know the generic name, we can derive all this information from the generic name. From the generic name, we can derive the drug structure also. I will tell in the upcoming classes, you come to know how it is. I am just giving a brief idea. Okay. Next one is organic chemistry. We need to focus majorly. Next one is pharmaceutical analysis. I have told you. See, in medicinal chemistry, they will ask 4 to 5 questions. Those are from synthesis, like IUPAC name, or basic nucleus, or else like structural activity relationship and chemical classification of drug. Okay. Next one is pharmacology. In case of pharmacology, when you are reading the pharmacology, we need to know first the classification. First, we need to know the classification. Next one is mechanism of action. Next one is specific use, adverse effect, antidote, and drug interaction. So when you are reading the pharmacology, just you need to know, about this classification, mechanism of action, specific use, adverse effect, antidote, and this. When you are reading the pharmacology, just you need to focus majorly on this topic. Classification and mechanism of action more important. So what are the topics we need to cover in general pharmacology? Means like ADME, pharmacokinetic, pharmacodynamics. Here the receptors will come, adverse drug reactions, clinical trials phases, phase 1, phase 2, phase 3, like that. Enzyme induction and inhibition. Okay. The next one is autonomic nervous system. In autonomic nervous system, we need to focus the sympathetic, sympathetic and sympatholytic, parasympathetic and parasympatholytics. So these are the topics we need to cover, and we need to focus majorly in pharmacology. Okay. Next one is cardiovascular system. In cardiovascular system, we need to know about the pathophysiology, specific use of a drug, and drug of choice and mechanism of action. mechanism of action. Okay, next one is central nervous system. Manoj, my voice is clear now? And the slides are also
Yes,
visible.
yes.
Hello, Manoj?
Yes,
Manoj?
sir. Yes,
Everything
sir.
is, okay, thank you.
Yes, okay.
Next one is cardiovascular system. Here, pathophysiology, specific use of drug of choice and mechanism of action. So we need to focus this topic majorly. Next one is central nervous system, epilepsy, psychosis, depression, mania. Okay. Next one is Alzheimer's disease. In central nervous system, we need to focus this. Next one is chemotherapy. In chemotherapy, we need to focus majorly on cancer. Next one is anti-tubercular drug, antibacterial, antiviral, anti-malaria. Okay. In case of respiratory system, we need to focus about majorly the asthma, anti-asthmatic drug we need to study. Okay, like see asthma we need to study. In case of GIT, we need to study the ulcer and anti-ulcer drugs. Okay, next one is hematology. In hematology means blood. Regarding blood, we need to study about anticoagulants, antiplatelets, fibrinolytic and antifibrinolytics. Next one is hormones. In case of hormones, we need to study like insulin, oral hypoglycemics. Okay, next thyroid, antithyroid. In hormones, majorly we need to focus this area. See, under hormones, lots of topics are there, but majorly we need to focus this. Okay. Next one is contraceptives. With contraceptives like thyroid, antithyroid, all these three. So I will tell one reference book for this. For pharmacology, you need to refer all of you need to refer Sparsh Gupta. For mechanism of action, you can follow Shanbag. If it is there, means you can follow Shanbag. See, Sparsh Gupta, we need to follow. It is Sparsh Gupta is very important for competitive exams. Okay, like Gpat. This is very sweet and sharp information is there in Sparsh Gupta. Just you can go in Google Drive. You can just open the Google, and in that you can type Google Drive. Then you can just search in the Google Drive as a Sparsh Gupta pharmacology. Then you can get this book. You can download it and you can read. Definitely, all of you need to read this Sparsh Gupta for Gpat. In case of pharmacology. Okay. Next one is like other minor subjects are there. Minor subjects are there. So we need like microbiology, biochemistry, inorganic, human anatomy and physiology, pathophysiology, pharmacology. Just these are minor subjects, and we need to focus this also. Like 10 or 15 days is enough in order to read these minor subjects. Okay. Also, this is about the basic information I need to give today. So first, all of you need to know about the Gpat. First, what is the importance? Whether any importance are there or not. First, we need to know. Thereafter, we need to